Good morning, good afternoon, good evening. Wherever you are in the world, welcome to the Stardust Show, powered by Radio Works World. I'm very happy to tell you again that I'm the good news bearer. So I always bring people who will have a good story for you or something that is going to change the way you look at yourself, the way you look at the world, something that is going to help you to see that there is more. There is more. Life is about celebrating. And in this season, especially in December, I want you to feel abundant. I want you to remember that you are stardust. From all over the world, we receive lots of blessings, and I'm so grateful. I have to use this opportunity to say thank you and for all your love, for your unconditional support. I'm here to say thank you from the bottom of my heart. Tonight we are going to have an amazing story, and I'm very privileged to share this show tonight with a very dear friend of mine. He is going to tell you one thing or two that you never heard before. And my friend is also an author, an amazing book that I'm still reading because it's a big book. Also, I would like you to read the book because it's going to change the way you look at happiness. Over to you.
Good evening, good morning, and good afternoon. Just like you said, if I'm speaking to the world, then I better be very precise. My name is Dr. Srivatsa, and Marina Nani has kindly asked me to explain what I do. I'm a person who sells happiness. Majority of the people ask me, why do you call your book Maya Bring Tears of Happiness? The reason is, I worked in intensive care for a long time, and one of the things I always saw when a child who's sick, been woken up or resuscitated, the mother came to me with tears in her eyes. They were overjoyed, they were very happy, and that is a moment which you have to be in my shoe to understand. Because the parents assume that I'm God, though I'm not. As the church said, I play God. Yes, I do. So over the years, I have used to that, and I have practiced that all my life. So when I wrote the book, it is just to make you understand that happiness is mental and physical well-being. How do you achieve that? Most of the people carry on job as they are. Only when they fall ill, they have some symptoms which they get worried about. They start looking at Google, read all the conditions, and then they start feeling anxious, worried. They ask the relatives, friends, family, nurses, chemists, what are we supposed to be doing about this? The reason is they think going to a doctor is going to be very expensive. There are thousands and thousands of doctors who are not going to be counting money. When you're sick, they will offer the support and help because we are basically humanitarian. We can understand your pain and we know your suffering. So we help. And unfortunately, in the last 10 years, things have not gone the way we imagined it to be. Healthcare has become too expensive. We are getting very busy because people look at Google or some other internet website and assume they're not well and they rush to a doctor, and that becomes very expensive. Or they consult relatives and families who advise them something different. So the reason I've written this book is to share my knowledge and experience so that you can read and find out what the doctor would suggest and advise. Because there are two problems. If you rush to a doctor, it becomes too expensive, and at times it is not necessary. 8 out of 10 people coming to see me in an emergency clinic didn't have anything serious, they should have rushed to the hospital. There was nothing I can do. I just wanted to listen to the story and said, there's nothing wrong with you. Apart from that, I didn't have any drugs or advise any treatment or investigations. So the idea is, when should you consult a doctor? And how soon should you? So some people assume they have cough, cold, flu, which doesn't mean anything according to me, and assume that they are just getting a viral infection and stay at home for a longer duration. This results in complications. And when they come to the hospital, they are coming too late. And we have to do more tests, investigations, which cost money. Unfortunately, there are some hospitals which dictate terms, and our freedom has been taken away. If a person comes with common illness, at times the health authorities, governments, healthcare providers give us a protocol which I have to strictly adhere. So tests which are not necessary, investigations which are not necessary are performed. And who pays the bill? It is people like you. So wouldn't it be easier if you can read my book, learn about it, and ask the doctor, why do you want this blood test? Why do you want an X-ray? Why do you need a scan? Is my management going to be changed? Is my management going to be different? 90% of the time, an illness is diagnosed by the doctor only after listening to your story. Even using a stethoscope is to confirm the diagnosis, not to make a diagnosis. So, Maya, bring tears of happiness, does not only make you save money, time, unnecessary tests, and going to hospitals these days can be more dangerous because there are bacteria which we cannot kill. So you might get cross infections, and often the doctors will prescribe you antibiotic. So to reduce all this, reduce the cost, and hopefully using my app, I can share this knowledge throughout the world to reduce the social inequalities of health and give standard advice for every patient all over the world. I hope I made it clear, Melina. And if there is any question, please ask me. Thank you.
Wow, it's so powerful. You know, while reading in your book, I like the way you approach the no nonsense attitude you have towards everything, towards yourself, towards the medical profession, towards other people, towards their suffering, and you come with solutions. Because each time, like you said, a doctor put a diagnosis on your illness, on the way you feel, is based on the story you are telling them. So maybe learning more about your own body, learning more about the actual cause of your suffering could exclude a lot of stress and save you a lot of money. At what point you decided to take this journey and become an advocate for happiness?
Yes, it is based on my personal experience. I was working in the hospitals in pediatric intensive care, acute pediatrics since 1983. By the end of 1999, there are lots of changes happened in the National Health Service where they started talking about evidence-based medicine. Evidence-based medicine is based upon the statistics which we collected. It does not mean to say penicillin is the 100% choice for a sore throat. It merely is a guideline for a doctor to choose. If you have sore throat, the chances of you having streptococcus infection is about 80%. So the first choice based on that, I have to give streptococcus, give penicillin. But using that rule, you cannot treat every condition as stipulated by the guidelines because the 20 people are not going to respond. So clinical diagnosis is based on the experience the doctor has acquired over years of training. So in 2000, I was asked to train nurses to prescribe antibiotic. To prescribe antibiotic, first you have to get the diagnosis right. And after getting the diagnosis right, then you have to give the treatment. In 14 days, I felt very uncomfortable because I cannot teach what I had learned in the last 30 years in 15 days. If that was medicine, then there is no need for doctors training. There is no need to have medical schools and training. So at that time, I felt this is not right. We should not just dish out antibiotics. As I wrote in 1996 in the BMJ, I said every person comes to see a doctor or a medical profession with the story, the way they have lived and experienced. And we have to just listen to the story and offer a solution or an advice and not a prescription. Every time I had to give a drug, I thought 10 times before I gave it. Because introducing chemicals into somebody's body is very easy. Because as a doctor, if I say, take poison, people trust us and they take it. So I will not give a drug unnecessarily. So that is the reason I started looking at what makes a patient or a person rush to consult a doctor. So in 3 years, I collected the common symptoms. That is called the presenting symptom. Like some person comes with headache, which they can't bear. Somebody comes with history of cough, fever, sore throat, the most important symptoms. I assumed there will be hundreds of them, but it wasn't. There were only 12 common symptoms. Then I looked into it further to see, of these 12 symptoms, how many patients in these 12 conditions have I examined? When I looked at it, out of the 700 patients, 76 patients could have been managed by somebody else. Or if they have a book like Maya, they don't have to see a doctor. So the 24% of patients should have come to see me. Why? Because they had a lump, they had a rash, which they cannot explain. So I had to look at the rash. That's all. Lump, I had to just feel the lump. Even including that, only 16% of the 24 needed a clinical examination. So why should a patient rush to see a doctor when it may not be necessary? There are lots of doctors now offering telephone consultation. I've done that for 30 years. Majority of the doctors will somehow or the other ask you to go to a hospital for a consultation. So that is not a good option. So if I can produce a tool which can be accessed by the patient without rushing to the hospital, then that is the best tool. So I sat with the computer engineers, and before that, I created a card system where I had 6 cards in which various symptoms, like fever on its own, is not useful. I want to know, is the fever high, moderate, mild? Is it associated with chills and rigors? Are you feeling hot and cold? Is the temperature going up every day or once in 2 days, once in 3 days? So there are all subclasses, and that is more important. So most of the patients think, oh, headache, I have a tumor, or headache, I have blood pressure. It is not so. We need a combination of symptoms. It may be two, it may be three, and it may be six. But on the whole, I realized that only three symptoms are important. If I can develop a system, then using these three combinations, we can reduce the number of people visiting hospitals or doctors by 80%. And I think that will help us. Why? Because 80% of the people can get what they need reading my book or through the app. And the 20% who come to see us, we will have more time to spend rather than rushing about, making medical errors, which leaves the patient with long-term problems. So that is the reason I have created this. It's not only for you, but for me as well. Because as I get older, I will need my doctors. And if they are going to mess me around, then it's not good enough. I haven't done my job well. I have taught what my teachers taught me, and unfortunately, that has not been carried along. People are more into investigations, scans, and blood tests. If all these things can diagnose an illness, and I think we could have had a computer which could have done a better job than us. Medicine is not a branch where you can diagnose any condition based on tests, investigations. The most important thing is to listen to your story. What you tell me is more important than all this high-tech medicine. If I can't listen to what you say and how you say it and do the basic clinical examination, they can simply shut the medical schools and say this profession doesn't exist, because people like me will not stop at what I have done. I will produce a little doll which will probably do a better job than any of these artificial intelligence, computers, or equipments can do. We are so dependent on these equipments and tests, we have forgotten our basic medicine. And that's why I am not going to keep quiet, and I will struggle along and make sure that everybody gets this message. Trust yourself. Your heart knows what's wrong with you. Don't be dependent on doctors like me. We are here to explain your problem, not cure you. In 30 years, the one and the only drug which cured any illness was antibiotic, and we have lost it. That's not because people like us didn't know, but the people who left training and went out into the community have simply dished out antibiotics with no reason, and unfortunately our children have to suffer with no antibiotics.
I wish we had more time tonight. Please
Okay.
go and find the book. It's Maya, Brings Tears of Happiness. It's a beautiful book. I enjoy reading so far. I'm halfway through.
Okay.
But there is an app, and if you want to give us the address for the app for people to download the app, which is a gift from you for our listeners tonight.
Yes, Maya, Dr. Dr. space Maya is an app which is available in Android and in iPhone apps. So if you just put Dr. space Maya, you can download it, and it's free. And I want as many people as possible to download it. Thank
Thank
you.
you so much. Thank you so much. It's been an absolute privilege. Don't go away. We have another show starting in a couple of minutes, in 10 minutes.
Okay.
So have some tea, have a break. Just look at the sky. I know it's cold outside, but it's nice to have a walk. So come back for the next show. And after that, we have another show. And after that, we have another show. All day has been filled with amazing people, with extraordinary stories, with Stardust solution to your struggles. Nobody wants you to struggle anymore. There are tools created by inventors, humanitarians, authors, doctors, people who put their life online to give you the best there is. And remember, you are stardust. From both of us, until next time, is goodbye. Thank you.
Thank you.